Hi, I'm Dr. Eric An. I currently work at Awaken Aesthetics and East West Eye, LA. I've had the pleasure of having wonderful training by wonderful people at the Cleveland Clinic in ophthalmology, also at the Johns Hopkins Hospital and KCI Institute. At East West Eye Institute, my responsibilities there include treating medically related conditions of the eyelid, face, neck, and sometimes the body area. My primary role is to treat conditions of the eyelids. We run a large ophthalmology practice, and so we see a lot of conditions that affect people both visually. They can range from things related to aging that can affect vision. They can be as serious as tumors or diseases behind the eye. They can even be as scary as injuries around the eye socket. And so, that's where people come to see us for that kind of thing. We treat them as best as we can, take good care of them. The other part of the coin is I also do cosmetics. I spend the other part of my time at Awaken Aesthetics, where we do plastic surgery of the face, neck, and body. We do non-surgical and surgical treatments there. We have a wonderful staff of a nurse, myself, and 2 other members who take great care of everybody. We had the luxury of joining with NVISION. So one of the very nice things about NVISION is that there's attention to detail, there's attention to efficiency, there's attention to patients, there's attention to staff, and there's attention to everybody else involved. So it goes from the top all the way to the bottom, which is nice. You don't usually see that everywhere you work, but when you do, you know that you're part of a remarkable process. And so I'm more than fortunate to be here with NVISION. I think the number one thing when it comes to good patient care is you have to listen to the patients, and we're here to help you. We're really devoted to caring for you, listening for you, everything from super big to super small. There's time for you to tell us. There's never any rush. The most important thing, though, is that when we talk to you, we develop a relationship, and I like all my patients to know that when I speak with you directly, I'm talking to you as a friend, physician, family member, maybe brother or sister, or both. And so that's where we come from, is honesty, and for you to understand, as much as I can tell you, and for you to let me know how I can help you, and if I haven't explained things well enough. When you come see me, whether it be at Awaken Aesthetics or East West Eye NVISION LA, the number one goal is for me to be a good educator for you. Meaning what? I'm not there to sell you surgery. I'm not there to push you into anything. More importantly, I'm there to teach you about why you came in, what you're wondering about your condition, what are your options to do about it, and I actually expect you to go home, study everything I talk to you about. If you forget everything, because if you're anything like me, I forget a third of what I talk about during the visit, reach out to me and ask me. Once you've really gotten a good grasp of what's going on and we've really answered your question, the next step is, what should we do? So that is a dialogue between yourself and me. The older way that I think that a lot of physicians used to be is that we just you do it this way. But it's different now. We're teammates. We have to work together. I always say, I do my part, you do your part, we're tangoing, and so we need to be good partners for each other. When we establish that, then we know, okay, so this is what you want to do. So let's say, for example, we're doing surgery like a blepharoplasty, where we remove some skin from the eyelid either to help vision or just brighten up the appearance, or sometimes both. That process involves my whole team. So you have my whole staff helping you from top to bottom, whether it be from administrative stuff, paperwork, insurance, medications. And you have me too. You'll have, when we get time to do surgery, I'll meet you at our surgery center. You'll be greeted by the whole team. They'll call you before, during, afterwards. You get a lot of phone calls of love. And our number one goal for the whole team is that it's all centered on you. You're not just one person in a chain of things. This is focused on you. This is your experience. It should be as best as we can provide for you. When you have your procedure, we're really going to give you the best that we can for comfort. We're going to do everything as perfect as we can. One of the big things I always tell everybody is our 2 mottos are safety, and I will quadruple, 5 times, 10 times check everything, do everything as best and as perfectly as I can. Those are the only 2 things I can guarantee, and really, I really mean that part. After surgery, my patients all have my contact information, so you might wonder should I bug Dr. An? Is this a stupid question? There's never any stupid questions. I totally like to hear about things. And in a little selfish manner, if something's bugging you, it'll probably bug me too. So I like to hear about it because I will feel a lot better about it. So thank you for letting me know if anything comes up. And really more than anything else is it's not just about the things before or during surgery. Equally important is after. We have to make sure that you heal well, you get the outcome that you want, and you have to let me know, what you notice, what you don't notice, and be in good communication. So it goes from A to Z. It's not just, this, and this. We want to make the whole experience as great as we can.